And our speaker today is a new first-time speaker for our webinar, Dr. Rohan Jagtap, who is the director of the Division of Oral and Maxillofacial Radiology at the University of Mississippi Medical Center. He received a dental degree in India, and then he earned a dental degree at the University of Mississippi Medical Center. He also completed his oral and maxillofacial radiology residency at the University of Florida, and he completed a master's in healthcare administration from Midwestern State in Texas. He's the co-author of Artificial Intelligence in Dentistry, which is a very comprehensive look at the evidence-based data on AI and its implications for dental health. So I'm very excited to have Dr. Jagtap join us to share his cutting-edge ideas on artificial intelligence in dentistry. I almost made it through there, but
Yeah.
It's all yours.
Can you all see me now and my presentation slide? Can you see now? Better?
That's much better. Thank you.
Yeah. So first of all, thank you, Dr. Park, for introducing me and inviting me to this seminar. Am I clearly audible to everybody? Yes.
Yep, sounds good.
It sounds great. Thank you.
Okay. So today's topic is AI in dentistry. I'm working in the AI field since 4.5 years and done multiple things, and I will happy to share with you in this presentation. Looks like we have 40 minutes for this presentation. So in the beginning, I'm going to go through some of my introduction a little bit more, and then go to the what AI is. It's a little technical aspect. You might not like it, it's boring, but then we'll go to the exciting aspect, like what is the application, how it's going to impact your practice, and how you will be able to use it. So first disclaimer, I have nothing to disclose. I'm not trying to promote any products here or any AI company. In 2015, January, I moved from India to the United States after completing my dental school. I just wanted to do something exciting, so I thought this would be a good route. This is the place I belong to in India, Nasik. It is a city well known for temples, onions, lots of caves, and also wine now. So you can see the big population over there, maybe 15 million people in one city. This is the university I did my health administration master's after coming to the United States. I go Gators. Yeah, I did my radiology residency here, and then I joined UMMC. You can see I also completed my Doctor of Dental Medicine at University of Mississippi as a faculty. So I graduated in 2024. So I did that while working full time. Recently, one of the good thing happened was that in 2023, Department of Defense gave me appreciation letter stating that the work I did for the Army, Navy, Air Force as an independent contractor to get them ready. That was exciting news. Then again, I was invited by Government of India to present for their AI conference. I have some more honorary fellowship, Peter Fishard, Academy of Dentistry International, and American College. These are the organization I'm affiliated with as of now. From ADA to RSNA to ADIA. I presented all these conferences as well, including AOMR. This is an exciting thing. We have a 20-month-old baby. So he's keeping us very handful. So very busy with that. So AI, you all are using AI every day in your phone. You're trying to heart rate monitor on the watches. Also, you're trying to sleep tracker, or maybe trying to get the blood sugar level, or how you're going to control the body weight, and then ambulance and everything. Everywhere there are AI algorithms are used so that you get automatic response and you can monitor things the way you want. So you are already using artificial intelligence, but we're going to talk about it, how it's going to applicable in dentistry. A little bit of history. Around 1950s, there was the first time somebody talked about AI was Alan Turing. He wrote an article about can machine think? And then there was 1956 when the first conference happened in Dartmouth. That was artificial. This term was coined over there by John McCarthy. But after that, nothing happened. Like there was AI winters since until 1970s, until around 1990s, the AI winter ended, and then interest of the AI project started back again. So around 2001, it's called as AI, 2010, it's called as AI Springs, because the technology started developing again and people were excited about AI. And around 2018, the World Health Organization talked about the big data can be used for health policy decision making. So this was an article by Alan Turing. Can machine think? John McCarthy, father of AI, he coined this term. Basically, what he was trying to say is if all the features of learning and intelligence are defined down to the smallest details, then computer will be able to simulate that, and results will be, it would be able to think like a human. I worked with the American Dental Association on the white paper. I was a lead for radiology, pathology, and endodontics. And these are the two terms we came up with: artificial intelligence and augmented intelligence. ADA was more inclined toward augmented intelligence. The basic difference is that augmented intelligence is designed to enhance human intelligence rather than replacing it. So the term artificial intelligence is about more of a machine able to do the work which is done by the natural intelligence displayed by humans. But augmented is more of a tool as to assist clinicians than replacing them. So they love this augmented intelligence term a lot, and we accommodated that in our white paper. The specialty which I belong to, it's a 9th ADA recognized specialty, which is oromaxillofacial radiology. It concerns with the production and interpretation of images, as you all do in your practice, FMX, panoramic, and it is related to diagnosis and management of diseases, any disorders and condition in the oromaxillofacial region. As you can see on this slide, that radiology really plays a central role in all the applications. Like in diagnosis, in day-to-day practice, you're diagnosing any caries, periodontal bone loss, apical pathology. Oral surgery is doing surgical cases based on the radiology, like cone beam CT changed how we practice dentistry. Endodontic is using a lot of cone beam CT now. You must have seen endodontists taking CBCT a lot to know the root anatomy. Orthodontics using for treatment planning, a lot of CBCTs. Implant dentistry and general dentistry is like day-to-day you are using 2D and 3D imaging. So what is artificial intelligence? It's basically the machines capable of doing human tasks through learning and adaptation of external data. This is so important, external data, and we'll talk more about it. So the task can be just like you're using a Siri or Alexa in your house, making, recognizing speeches, making decisions, solving problems, playing games. These are some of the things AI is already being used. In medicine, it is helping in case of prediction of disease risk, diagnosis of pathologies, again, treatment planning and prognosis of the treatment is playing a vital role. So these are some of the major areas AI is helping nowadays. How does it work? So I like this image so much that first of all, you have a good data, like you have a 2D imaging such as panoramic FMX or CBCT would be there, you have to get the data first. Then you clean, prepare, and manipulate data. So you would eliminate some of the errors, like any artifacts. You want to include that. And also you need to include the findings you are trying to train computer on. So for example, if I want to train a computer on caries, I want the data which shows caries. So you would manipulate the data, you would train the model applying to an algorithm based on your manipulated data. Once that model is trained, you would do the testing, that how it is performing. If it is accuracy is less than 95%, you would start back to step 1 and you would improve it until you have accuracy which shows 95% or above. There are two subfields of AI, machine learning and deep learning. Arthur Samuel coined this term machine learning. Also, the algorithms which I just talked about consist of sets of instruction. So basically, algorithms are instruction that guides the computer action. These instructions, algorithms can be decision trees, neural networks, or deep learning. So we'll talk about each of them very briefly. So decision trees are employed for decision making. Neural networks are recognized for pattern recognition. So that's what we use a lot in dentistry. That we want to make sure that computer is learning those patterns. And deep learning is more complex image like tasks it can do, like more complex nature of image analysis or speech recognition. Deep learning is used. So basically, human intelligence works as in perception, interpretation, and response. But in case of artificial intelligence, it has a data and outcomes, engineered features, feature mapping. The main difference between machine learning and deep learning is that deep learning, it also learns, not just maps. So it automatically learns over the period of time, and it gives the same output as a human would do. So machine learning is a subset of AI. It enables computer to learn from the data and improve their performance over time. It involves the development of algorithms that are capable of learning and then improving based on the experience in future. Again, if you are looking for vast data sets and identifying patterns, this is really helpful. Deep learning is another subset of machine learning, where basically the main difference is more neural network. It's more deep, and you can analyze large data sets with it. And also it helps computer to recognize those minute intrinsic patterns. In deep learning, the mainly thing is used in artificial neural networks. What are those? It is basically function as a structure. It's the same as a structure and function as human brain. So the way our brain works, I have another slide I'm going to show. It is similar to functions as a brain. So this AI is trained by enormous amount of data. And again, better and more accurate outcomes comes when you have a better quality of data and a variety of data, not just from one place, but it has to be globally. You should get data from different samples, and then you should train your model. So that's how it's get trained. So again, deep learning is more complex. It has multiple layer of neurons. And also that's why it's called multiple neurons are distributed in large layers. So that's why it's deep learning neural network. So basically the layers I talked about are divided into input layer, hidden layer, output layer. That's how it's divided. I mean, it's more complex as you read more, but because limited time today, I would be just giving you this more inputs on the how input data, hidden layer, and there is output layer. All this is through the mathematical operations. So we are working on a lot of algorithms on the back end that helps to get you the output. So this is how the deep learning network looks like, and then you would see the output is more filtered, basically. There are so many hidden networks. So neural networks are represent human neurons as artificial neurons. It is just that it is mathematically in a computer nonlinear model. So are trained by large amount of data, and at the end it would represent the same intrinsic patterns as provided data. It is mainly based on the repetitive exposure of data points and labels. Like for example, if I want to show them periodontal bone loss, those bone loss points, like from the cement enamel junction to the alveolar crest, if it is get exposed, that algorithm gets exposed with the same data points and labels, it would eventually learn. So that's the basic concept of it. It starts with basic questions such as image classification. Does this radiograph has a dental caries and periodontal bone loss? Yes or no? So that's how we started. But you will see that the product now is so good that it can automatically do so many good things. Is everybody following me? I mean, I know I'm going a little quick, but I wanted to share a lot of information in here. Yes. Okay. So this is how the artificial intelligence compares with human neurons. Basically, input, hidden, and output layer is divided into, just like our neurons are. There is input from dendrites, there is myelinated sheet, and there is output, and there is synapses. So similar model in case of neural networks. I wanted to show an example of a dog. Like for example, if we are training a computer to identify a dog, it would do a similar way. Like it would take a segment of a dog's image, and then it put it in the convolutional layer. And you can see like there are different slices of that layer, and that small image would be a small piece of one slice. And then after training, after getting all the filters, the pooling layer would be able to reduce the weight count of those images and it's gonna synchronize in a proper way. And then flattening layer will be preparing that data, which would go to the machine so that machine can learn. So that's the simplified format of these layers. These are some of the algorithms we use, AlexNet, ResNet, UNet. Most of the articles, if you read, would be using some of these algorithms. This is quite a good image where I would like to explain how the AI finally works. Is that deep learning is based on 4 fundamental things: classification, object detection, segmentation, and pinpoint. So basically, this is the image of a cat. If I want to train a computer to identify a cat, so it would do a classify, it would create a box around the face of the cat. So that's localization. Then what we would do is that we would confuse the computer with the dog and cat image, but then train exactly the box around the cat so it can identify how the cat features looks like. So that's object detection. Once that box is formed and the computer knows that this is how the cat looks and this is how the dog looks, then it would segment the border of the cat. So that's a segmentation tool. That's how you will see the images. We segment that caries, periodontal bone loss, periapical radiolucency, anything, impacted teeth, anything will be segmented. And then computer will be able to pinpoint exactly how the cat is because it learns from the different features on that segmented model to get trained. So these are the 4 points. Python is the language. So if you have any relatives and they want kids to go to computer science school, this is the language I would recommend to learn because this is all about AI. Now is the exciting part that how AI is impacting dentistry. It started with the medicine, that medicine accepted it as a tool. But now AI is going in the same direction because we have so many 2D and 3D imaging for diagnosis and treatment planning. So how the combination of imaging and AI works, I would like to show this data of a CBCT market in the United States. It's around 10.8% growth rate through 2019. There was a report from 2014, 2015, that was 10 years ago, that there were around 300,000 pediatric CBCT studies are performed and 387,000 CBCTs are performed on adults. These numbers are completely changed now because now we are talking about 2024. There are so many CBCT machines are available and more practitioners are buying them. So these numbers will come in 2014, 2025, and I think it will be a huge growth rate. When AI started in doing research, you would see that lower column shows only panoramic or 2D imaging. But then now you can see there's more of 3D imaging research is going on a lot on the AI aspect. So deep learning, again, we need a lot of computing powers. So a lot of AI companies are using NVIDIA chips for training it. We need large amount of data. We need multi-layer neural networks, and we need a statistical methods to train the model. So now our part, how it applies to our field. So I'm going to go by each specialty and general dentistry as well. In case of pathology, it is impacting any pathology you see in our dentistry, whether it is going cystic lesion, tumors, TMJ disorder, sinus pathology, day-to-day general dentistry pathology. It is diagnosing and also giving a treatment plan for those. So some of the models are FDA approved, so you can use them. Some of them are under research, so they will be available when they get FDA approved. But basically, the AI is mainly foundation is based on the diagnosis of the imaging as of now. So this is a good example from our ADA white paper that if you want to examine a single tooth, this is the image of a tooth, then we are focusing on anatomical landmarks from cement enamel junction to alveolar crest. Then final results will look like this, and the clinical results will give an idea about this is a tooth number, how much is the bone loss in case of millimeter on both sides, nasal and distal. So that's a bone loss. Other applications are teeth segmentation. Because we started very new, we needed to train algorithm. The basic start was from teeth segmentation, like identifying teeth numbers. I think I'm not. Yes, I'm gonna explain more on diagnosed sinus TMJ as well as I go forward. Thank you. So identifying teeth numbering, that's what the basic algorithm. You might think it's just anybody can do it, but not the computer. So that's how we started. So this is our panoramic image. Left is a patient image, and then right is an output by one of the company. And that was an FDA model. We use universal naming system. They use FDA. So FDI system. So that's why you would see the numbers are different. This is how the tooth identification looks like. This is another good image which shows caries, also the depth, how much is in dentin and enamel, root canal, morphology, also dentin enamel. Here it shows the extent of the decay also. So that would help you a lot when you plan a treatment. This is interesting papers about tooth caries segmentation on photographs. A very good study, accuracy was around 81.9%. And as soon as you upload photographs of patient, AI would be able to tell you caries detection. Transillumination, that was another good paper that looks at like 83.6% accuracy rate based on transillumination technology. This is an interesting, let me know if you're able to see. This is our 3D model. This is done by all AI. AI is doing it. We trained the whole 3D model, and it is able to identify mandibular canal, sinuses, a nasal cavity, TMJ, everything. I hope you all are able to see this video. You can see the airway analysis as well, all sinuses, canal, close proximity with the mandibular canal of the molars, third molars. Other aspect is about, again, pathology. Like, for example, we are looking at this impacted tooth, but there is a big pathology. So this is all these images are by AI identifying it. So you can see a well-defined, like a dentigerous cyst, and it's identifying it. Also retained root, any pathology. There is no software which is differential diagnosis it is giving right now, but at least it's pinpointing out there is something going on which you should be aware of. Again, anatomical landmarks on panoramic radiograph. I know there is a lot of superimposition, but AI is actually able to do the anatomical landmarks as of now. Perio and endo, basically in periodontology, that a lot of periodontal bone loss, plaque detection, also calculus detection. These are the application as of now. In endodontics, whether we do the periapical pathology, working length determination. I will show you this image of segmentation. This is a panoramic radiograph of patient, and as you can see that AI is able to identify it completely. Another good paper on prediction of bone loss with the performance of 0.69. So as you can see, different panoramic image showing bone loss in different areas. Again, plaque detection. This is another application in periodontics. As you can see here, that a tooth has a plaque on the cervical margin, and then output looks like a yellow thing, which is basically showing that where the plaque is. Periodontal disease diagnosis, again, based on the photograph. This is another good study. Again, accuracy is around 87%. And as you can see, soft deposit localization in here. This was our patient. We trained the model, and with the photographs, it's identified teeth. And also you can see that it is able to determine the plaque and also some of the anatomical landmarks on the photographs. So the right image where you're looking at is the AI, that is prediction. The real is the one we inputted. In case of endo, in case there is detection, pre-treatment, and prediction. In case of detection, periapical lesion, crown root fractures, foramen determination, quality of existing canal, pre-treatment, working length determination, root canal system morphology, and also outcome of endodontic retreatment or viability of stem cells. That's the prediction model. And here you can see that actually the pulp chamber and also canal morphology and bone loss. This is another image showing restoration and bone loss. We did a cone beam CT study for mesiobuccal canal segmentation, and we already published it. So I will show you the image right here of a cone beam CT. On the right side, you can see that the red dot on MB2 canal is by the humans, and it is predicting. The blue ones is a prediction by the AI. I'm not able to point out this on the screen, but hopefully you'll be able to see it. That's MB2 segmentation. That's another application. Distal root segmentation. That's a good paper. You can read it around 86% accuracy. Again, tooth and pulp segmentation. I just added these papers just to show you guys how the pulp chamber AI can diagnose completely the root length and everything. Canal determination. Dental fracture. It would be able to identify dental fracture as well. That's another application. In ortho, CBCT has been used as a versatile tool now. Also localization of landmarks, which is so important in cephalogram. So that's one of the approach. Also in ortho, it's helping with the growth estimation, collecting the data, measuring the radiographs, treatment planning, also facial analysis. Also, it's helping with appliance production. So this is a good image which shows on the left side is a patient cephalogram. The middle image is about the human marking of the cephalogram landmarks, and the right one is the one with the AI prediction. You can see that blue and green, the red and green dots are so close to each other. It's very good accuracy. Again, the application cephalometric analysis, maturation, cervical vertebral maturation. I added these papers which helps orthodontists to have to make their treatment planning, and then accuracy of all of them were around 80 to 90%. That's really good. A skeletal classification, that's another application in orthodontics, and their accuracy was around 96.4%. This is another good paper. Airway analysis by this company, Evelmini, came out really good. So you can see the patient has a sleep apnea or not. So that's another very good application of AI helping with an airway analysis. This is a good paper on automatic pharyngeal airway detection. And you can see the image of the red and yellow airway analysis. Implant dentistry, it helping a lot in case of the implant treatment planning. And also the next application is about density, bone mineral density, if the implant would survive or not. So that's another area AI is helping. So this is a software, again, showing that complete margin of implants and any bone loss surrounding it. Restoration, it would be able to detect a root canal treated and then again bone loss. This is good paper about implant planning. It does a data on CBCT. It can help with the implant planning. Again, another good paper about bone loss detection with peri-implant bone loss. I'm just giving you quick ideas where it's getting applied. A really good accuracy rate. Again, dental implant fracture detection. That's where AI is being used. Again, it's in the research process. Once it's get FDA, it will be applicable to in our practices. This was the image I wanted to show you real quick. This is algorithm we trained with 1000 CBCT, and this is a 1001. So it's going to give you the width and the height at the different areas of the maxilla. I hope you all able to see this.
Yes, we can.
Great, great. This is an actual patient. Again, crown and restoration. If there is a marginal leakage, it's going to give you crown margins. so that we can prevent any marginal leakage. Color selection, AI is being used in the color selection a lot. And then AI would be able to tell you so that you don't have to hold the, try to match the shades or something. AI would already tell you which shade it is because you are uploading photographs and everything in the system. This is another Crown's model and CBCT root model with the other company, and AI would be able to do all the prosthodontic work once you scan patient. Facial deformity prediction, that's another thing that once you deliver a complete denture, that algorithm will be able to tell you that, okay, is there a facial deformity or not? What are the things you need to do? That's another application, really good success. Margin and just like I said, margin line detection. Once you upload, literally it is showing you in millimeters. If you see the right side bottom image, all the margins, it would show you how much you are in or how much short it is, or do you need to make any corrections. This is a photograph, like intraoral picture of a patient, and then you can see that AI played mucogingival junction and other features on that photograph. In case of oral surgery, I already talked about pathologies, but it can tell you how close proximity to third molar with the canal, would the third molar will develop in the right direction or not. And this is a very interesting study. I already showed you this image, but again, the important thing I want to show was this, that automatic detection of third molars and mandibular nerve by deep learning. Very good papers. And if that happens, I mean, we would be able to reduce a lot of malpractice suits, I guess. This is another extraction is needed for third molars or not. How much is angulation? Would that erupt in the right direction or not? And they had accuracy ranging from 78% to 90%. So this was another good paper. Maxillofacial trauma. As soon as you upload an image, AI would be able to tell you where the trauma is and how to do a treatment plan. Again, another paper of maxillofacial trauma. Again, this is another great application of oral cancers. If that, like, you can see that a medical CT looking at the lymph node ABC, and AI would be able to take if there are more lymph nodes are involved or not. So that's another thing. This is the paper my student presented in oral surgery conference recently, automatic impacted tooth segmentation. We created this algorithm on CBCT, and we find the correlation with the mandibular canal as well. This is a good paper about, I told you about predict that if third molar will erupt in the right direction or not. And the study shows that, I'm going to show you different pictures right here. The top image, A and B, A image is 4 years before, and then B is 4 years later. So AI was able to detect that if the tooth will erupt in that direction based on the planes. And they did this study on like 838 panoramic radiographs. That's what they did. A lot of patients they involved in this study. The accuracy was really good for them, ranging from around 79.7% to 98.1%. AI would be able to post-operative facial swelling will happen or not. AI would be able to predict that after the third molar extraction. This is a 3D segmentation modeling of a patient on cone beam CT. As you can see that on the right side is the CBCT software, and the left side is the AI outcome. Very good. ADA released the guidelines in 2022, and we are already working on other standards. But this was a white paper, and I did work on this. And this is a really good document if you want to follow in your practice, see where you're going. You can actually read these documents available. These are some of the research paper I published. I'm just going to glance through it. Multiple publications since 4 years. Again, CBCT magazine I published there. I published in IADR as well. These are the conferences we already presented. I started journey in 2020, so since 2021 we did a lot of presentation. These are just national, international. This is an exciting part that after 2.5 years of hard work, me and Dr. Khan were able to publish. This is the first book in the United States. There was other book published in Middle East, I guess, but this is the most comprehensive book published. We already sold more than 20,000 copies within 4 months. It got released around January of this year for maybe 6 months. So it's really getting great response. It's available on Springer website, Amazon, Walmart, everywhere. Recently, we were endorsed by the 6th NASA chief on LinkedIn. So he promoted our AI book, and it's almost 400 pages, and almost 19 scientists wrote this book with us. This is a link for the book, and it's available on all the major platforms. These are the major companies, if you want to know. These are the major companies currently in the field of AI: Overjet, Pearl, Wellmini, Relu, DiagnoCat, and CranoCatch. All of them are doing a really good job. Another future of dentistry is about in 3D, about virtual reality, and it's coming soon. So that would be the future where you would be able to show patient what's going on, and also dental education as well. We talk about exciting part. Let's talk about challenges real quick. Challenge is large amount of data is required. Lot of research is required. Make sure it's safe for the patient. There is a need for discussion and assurance to the dentist and all the specialists that it is not to replace you guys. It is to aid to you guys. Also, the final decision is yours, not the AI machine. Also, the cost associated with learning, machine learning, is very higher than traditional pathway. There are other legal issues about patient information, patient privacy, which we need to talk about. So these are the challenges. Limitation is because the data is sensitive, complex, and multidimensional. It's so hard to train a model with all the data. So it takes a lot of efforts. That's why the cost goes up. Also, the validation, once it is validated, it's make sure its accuracy is more than 80 to 90%. There is a lot of validation testing is required before the product gets FDA approved. Liability is another aspect that it involves doctors and specialists. They are still responsible for the patient care, not the AI companies. So it's going to help you, but the final decision of the treatment plan would be yours, or the diagnosis would be yours. So again, there is a liability issue going on, and I think the whole country is looking into this aspect, how we're going to negotiate. Future outlook for this is about robotics. AI can be used in robotics, as well as because its application is already in cone beam CT, more MRIs coming to dentistry, medical CTs coming to dentistry. So that is another aspect we're looking for. Also, the COVID-19 patients can be. So again, that's a good thing. In the beginning, when you said no selling, yeah, I'm not selling my book. Do not buy my book. So I'm just sorry if that went through, but I was just trying to show that.
We've got a few questions. Are you done? Because we would like to take some questions here.
Yeah, almost done. A few more slides.
Okay. So you mentioned some studies where AI did, you said, accurate predictions, let's say on what the complications would be after third molar surgery. I think that was one of the papers that you discussed. Are you familiar with any work that's been done comparing, for example, as clinicians with 30, 40 years experience, we also can look at an X-ray and look at patient data and make a prediction as to whether there will be complications after surgery. Are you aware of any studies that compare the ability of AI to make that prediction versus the ability of experienced clinicians to make that kind of a prediction?
Yeah, I think it's an interesting question, but we are very, I would say that's very next stage projects for us. But I think currently is more of a diagnosis and treatment planning based. But eventually, once our data is more trained and it learns automatically, I think we will go there.
You bring up a really good point, because this all depends on having tremendous data sets. Right. And, I can tell you from the Glidewell perspective, let's say we've designed 30 million monolithic crowns, right? So we have 30 million designs in the cloud. And so our design software is fortified by that, right? And like you showed quickly, I think you showed a program that does margin detection. We routinely do that, right? Because we've got 30 million impressions that we've scanned, or they were digital impressions, and we know where that is. We know whether that's a burr mark or it's just an area that was not prepared. So yeah, but as you say, tremendous amounts of data are required. Of the commercial AI programs that are available, and I know quite a few people that use them. We actually use one of them in our clinic. Do you find that they're accurate? Do you find that they're helpful?
If I would say their accuracy is around, if it is more than 90 to 95%. I already been on their FDA panel, most of the companies I showed you. So if they are FDA approved, yes, I mean, it's safe to use, but I would always rely on the dentist final decision. It's good aid, but not 100%.
Right. In other words, it might show you that the bone levels are significantly below the CEJ, right? But then you, as a clinician, need to determine whether that's a problem, what the trend has been, has been developing, things like that.
But I think it's helping in some of the things we are missing. Like for a cone beam CT, if it is a big scan, you're focusing on one root canal number 3. You're not looking at the whole scan, but it's gonna give you what's going on in other areas as well. So you can focus, refer the patient, or whatever you want to do in that area.
That's a great point, right? So things that we're not particularly trained to notice. Yeah.
Even on the panoramic, yeah. I mean, we are so focused on the chief complaint.
I had an interesting question here about on a 2D radiograph. One of the problems we have on a 2D radiograph is if we see bone loss, it's hard to tell whether it's on the facial or the lingual. Can AI determine where that bone loss is, whether it's a facial problem or a lingual problem?
If we provide them an intraoral scan plus cone beam CT, yes, it would be able to tell.
Okay. Well, cone beam CT would tell you right
yeah,
on its own. So
2D imaging would be able to do it. It's not ready.
Okay. All right. Can you see in the future a handpiece that has some kind of AI programming so that when all the caries is removed, or when your crown prep has reached a certain level of, let's say enough bone structure has been, or enough tooth structure has been removed?
Oh, I would say I would love that, but I don't think we are there yet. I would say it would come next 10, 15 years, but not right now. I don't think that's available.
Dr. Courtney's got an interesting question here. Do you think that the AI that's been developed will have any effect on peer review or malpractice cases? Are we on the verge of eliminating expert testimony by showing, or AI would show what standard of treatment is?
I think that's an excellent question. And I would tell you my experience I've been to multiple malpractice cases as a legal expert, and I would say AI will change that. First, it would help us to not do any harm. I mean, any dentist is not trying to do any harm, but I'm just saying that during the procedure, if that is happening, first AI would be able to tell you what are the things you need to look for, give you a lot of information so we can avoid it. Even if that happens, I think AI would be able to give us enough information that I would put it this way. 2 things AI would change. First is that it's going to bring the uniformity in dentistry. That if 10 dentists sitting and looking at a radiograph, I don't think they would agree with each other. But AI doesn't have any bias, so it's going to get rid of that bias. Second thing is going to bring the confidence into our specialty. Every patient, like most patient, thinks that we are trying to buy a new car with the money we're going to make on their procedure. So it's going to tell the same thing what practitioner is telling patients. So it's going to bring a confidence in our dentistry and specialty overall. So
I think that's an excellent point, that so much of our recommendations in dentistry are a little bit subjective. Hey, maybe it could be a 3-surface restoration, or maybe it should be a crown or an onlay. And the more that we can do that gives the patient objective data, that AI has determined that the best outcome here would be from a 3/4, some kind of an onlay or some kind of crown, something like that, versus.
And if you tell a patient that, okay, you need a root canal, and then machine is telling, oh yeah, yes, you need a root canal. Yeah, patient believes it. I mean, I would say that. So
I think that's a big benefit. Excellent. Well, I really appreciate you coming here and kind of giving us an update on where we are. Lots of interesting papers that you brought out. If we did have a question about where we can obtain some of these papers, is that just a PubMed thing, or is there
Yeah, I
on
mean,
your?
you can go on PubMed and just type AI in dentistry. That you would be able to see it. I mean, there is a lot of research going on. I mean, you can select the area of interest and just search it.
Great, great.
So
Well,
I
thank
would
you
just
very
end
much, Dr. Jagtap.
my
And I think your specialty of oral and maxillofacial radiology is a particularly good one to have wisdom into what's happening with AI, because I think that's one of the areas where it's really going to blossom quickly. So thank you so much for bringing your perspective to this, and thanks everyone for joining us today. We're going to be off next week for another symposium. We'll be back in 2 weeks, and as always, we'll have our business advisory panel. And our guest speaker will be Dr. Chris Resnick, coming back to talk about cement retained implant restorations. So we will meet back here then in 2 weeks, noon Eastern time, same time. And we'll see you then. And everybody have a good couple of weeks. Take care.